Hello, and welcome to the Dream Clinic examination room. Come on in and have yourself a seat at my exam table, won't you please? So, before we start your exam, why don't you get nice and cozy? Is there anything I can get you? A nice soft pillow, maybe? Yes, I know my table is just like that of a bed. We want our patients to be very comfortable. Would you like a blanket? It's very cozy as well. We want you to be very comfortable here. Okay, so is everything good? Yeah? Okay, wonderful. So, you're here because you're not sleeping well. Okay? I'm just going to type a few things in your report. Okay, this is going to be a very thorough exam. Today we'll be performing a very detailed exam while checking your hearing, your eyes, your sense of smell, your reflexes. If you have any tension or nerve twitches, and we'll be using a variety of ways and tools to do so. Okay? Great. That's good. Good, good. So, there will be sounds and smells, and I may have to touch you. I'll be very gentle. And then, towards the end, to help further move you into a state of relaxation, there'll be breath work and some stretching to loosen up. We don't want these sleep problems to keep bothering you. So, if you're ready, we'll go ahead and get started. Okay? Okay, great. Now, I'm going to go ahead and put on my gloves. As I will need to be touching you at certain points. Now it's the time for you to sit back or lie down and get as comfortable as possible. I was looking at the report before you came in, and it says that you've been having these sleeping issues for quite some time. Is that so? Okay. Maybe we can resolve that today. I'm certain that we can. Okay. Let me just warm up my hands. So, I'm the sleep doctor here, and I've helped many other patients come and go. I've helped them get to sleep, learn how to relax, wind down, and I'm sure that I'll be able to help you with the same thing. Some say I've even given them tingles. Mm-hmm. That's right. Tingles before drifting off to sleep. Mm-hmm. So, before we begin, can you please give me your full name with the spelling? Mm-hmm. Okay. And your birthday? And has your address or phone number changed since checking in and making your appointment? Okay, good. Okay, I think that I have everything here. Okay, so if you are ready to begin, I think my hands are nice and warm for you now. So, I'm just going to gently start touching your face, if that's okay. Check the muscle tension in your face, in your neck, in your shoulders. Yes, it is a very necessary step. Are you comfortable with that? Okay, good. I'm just going to rub my hands along your forehead. Gently press here and there, down your temples, and under your eyes. Later I'm going to ask you a few basic questions, just to see how things are going. Down your neck, and your shoulders. How's that feel? Okay, good. So, how have you been feeling since not being able to sleep? Have you had any dizziness, uneasiness, feeling unbalanced, maybe some confusion? No? Okay, good. What about headaches or migraines? Okay, okay. Okay, so I'm going to check your face just a little bit closer, if it's okay if I get closer to you. Check for some droopiness. So that sometimes happens when we get nerve damage from lack of sleep. Our muscles want to kind of do all kinds of silly things. Okay? Alright. Very close. Okay, does that feel okay to you? Not too much pressure? It doesn't hurt? Okay, everything seems to look good. Everything feels fine. I'm not feeling too much tension, so that's very good. We don't want you leaving here in any type of pain or anything. We don't want you to be uncomfortable. Tension can really build up after we've gone so long without sleep and make our joints and our whole bodies hurt. And you seem to be fine, so that's very good. We're off to a very good start. Okay. Next, I would like to check your eyes, if that's okay. So, I want you to try to look behind me, not at me. And I'm going to move my finger across. And up and down. Okay. Your peripheral vision seems to be fine. That's another good sign. Yeah, that's very good. Next, I have this light. It's not too bright, actually. It's purple. And I'm going to shine it. And I want you to look at it. And then I want you to follow my finger based on my instructions, okay? So, if you're ready. 1, 2, 3. Now look at my finger. I'm going to do the light. And hold it back here. Look at my finger. And do the light. Okay. Now the light's gone completely, right? Okay, good. So, your eyes seem to be working just fine. That's often one of the first things to go when we lose our eyesight and our nerves. And it becomes, going without sleep is very difficult. It has lots of different effects on our bodies and our minds. So, you're doing great so far. Are you still comfortable? Yes? Okay, good. I'm glad. Okay, so we're going to move on now, if that's okay. Next, I would like to test your sense of smell. Now, I know that some of these tests are quite odd and different, but they are very, very necessary. Okay. Okay, are you ready? Great. Okay, first, now I'm not going to tell you the smells. They are essential oils. I want you to tell me what you're smelling. And if you don't smell anything at all, I need you to let me know that as well. I have 3 different essential oils that we're going to be testing. And most people find them all delightful. Okay, here's the first one. Now, do you know that scent? You can smell it? Okay, what do you think that it is? Cinnamon? Yes, very good. Okay, here is the second scent. This smell, some believe to be a very invigorating scent. I do as well. Okay, can you smell it? Good. What do you think that it is? Peppermint? Yes, that's right. Very invigorating, right? Now, this smell, I'm going to give you a hint, and I probably shouldn't do this. A lot of people use this smell for relaxation purposes and sleep. Very good scent. What do you think that smell is? Lavender, yes. That's right, yes. So, your sight is great. Your nerves in your face, they're all working great. Your sense of smell, great. Everything is looking very good. I'm going to go ahead and put some notes in. Okay, are you ready to proceed? We're not going too fast, are we? I want you to be able to relax so that you can get to sleep. Yes, that's what we're both here for your ultimate relaxation. Yes. Okay, great. So, now we're going to test your hearing. So, the way that we're going to do this is I'm going to hold up a couple different objects close to you and away from you. I need you to tell me, without looking at the objects, you're going to need to close your eyes for this one. Without looking at the objects, if you can tell me whether they are close or far away. Okay? Okay, great. Now, if you're ready to begin, just go ahead and close your eyes. Is that close to you? What about now? Okay, very good. Next object. Can you hear on both sides? And can you still hear it? Okay, great. Okay, I'm going to try some different sounds. just to make sure that your hearing is where it needs to be. Now is this close to you? Or is it far away? What about now? Far away? And you can hear it well? Okay. That's great. Okay. One last item, just to definitely make sure. That's not a harsh sound, is it? Nice light scratching. And you can hear it well. If it's far away. And up close. And on both sides. Okay, great. That's perfect. I'm going to add this to my notes. Yeah, there's a lot of notes to put in. Okay, so I'm going to go ahead and remove my gloves now, as we're done with most of the examination. And some sanitizer. Are you still comfortable? Yes? Good. Okay. This is going to be your favorite part. This is where we will do some light stretching and some breath work to further relax you and help you wind down. This is my favorite part too. Okay, are you ready? Yes? Good. Good, good, good. Okay, so I want you to do as I do. We're going to move our neck to one side and to the other. And back again. And back to the other side. And one more time. There. Already getting loose. Now we're going to move our shoulders back and forward. Back and forward. And back. And last time forward. Great. Now, for our arms, we're going to go to one side other. Just like the other exercises, we're going to do each exercise 3 times. And the other. And finally, we're going to stretch out our backs. So we're just going to turn slightly to one side. And then the other. And back again. And back to the other side. And final time. Okay. Now we're going to do a step that helps to relax our eyes and our face, sort of. So we're going to look up and down and up and down, up, down. Now left and right, left and right, left and right. That helps get our eyes nice and tired. And finally, we're going to do some breathing. Okay? So, I want you to follow my lead. Let your mind clear. Lie back. Sink deeply into the bed. And close your eyes. Now breathe in through your nose and hold it for 4 seconds. 1, 2, 3, 4. And exhale through your mouth. 1, 2, 3, 4. And just like the other exercises, we're going to do this 3 separate times. So breathe in through your nose. 1, 2, 3, 4. And out through your mouth. 1, 2, 3, 4. And one last time. In through your nose. Deep breath. And hold it. 1, 2, 3, 4. And out slowly through your mouth. 1, 2, 3, 4. There. I hope that you can get some rest. I hope that your mind is eased and relaxed. So, keep your eyes closed. It's time to dream now. It's time to go to sleep. It's time for your rest. So, good night. Good night. Good night.